Watching a loved one age is never easy, and knowing when they may be in their final year can be heartbreaking. But what if you could recognize the signs early and offer them the best care and comfort in their final stages? In today's video, we're uncovering 7 subtle yet critical warning signs that your elderly loved one may be nearing the end of their life. Stay tuned, because understanding these signs can help you provide the love, care, and support they need during this incredibly important time. Part 1. The early signs to look for. Understanding the inevitable process of aging. Aging is a natural process that we all go through, but for families and caregivers, it can also be a challenging time. For elderly individuals, the process of aging can bring with it physical, emotional, and cognitive changes. But as we get older, there are certain signs that indicate that someone might be in their final year of life. In this video, we're going to explore the 7 warning signs an elderly person may be nearing the end of their life. And we'll also provide guidance on how to navigate these signs with compassion, understanding, and care. It's not an easy topic to discuss, but understanding these signs can help you make the best decisions for your elderly loved one, ensuring they receive the comfort and support they need during this stage of life. Sign 1. A sudden decline in physical health. One of the most noticeable signs an elderly person may be nearing the end of their life is a sudden and significant decline in physical health. This could manifest in several ways, such as a rapid loss of weight, extreme fatigue, or the worsening of pre-existing conditions like heart disease, diabetes, or arthritis. What to look for. Unexplained weight loss. If your loved one suddenly starts losing weight without making changes to their diet or exercise routine, this could be a sign that their body is struggling to keep up. In the final stages of life, the body may begin to use up its fat and muscle reserves, which leads to noticeable weight loss. Excessive fatigue. Seniors in their final year may experience extreme fatigue and exhaustion. Even the simplest of tasks, like walking or getting out of bed, may become too overwhelming. Difficulty eating and drinking. In many cases, elderly individuals may lose their appetite or even their ability to eat and drink properly. This can lead to malnutrition, dehydration, and further physical decline. Why it happens? As the body begins to shut down, it loses its ability to absorb nutrients efficiently. The heart, kidneys, and other organs may weaken, making it harder for the body to function at its usual capacity. How to respond. Monitor their health. Keep a close eye on their physical health, especially if they're experiencing rapid weight loss or noticeable fatigue. Consulting with a healthcare provider can help you assess the situation and determine if there are any medical interventions available. Provide comforting care. If eating and drinking become challenging, focus on providing nourishing liquids, soft foods, or high-calorie shakes to ensure they receive the nutrients they need in a manageable way. Sign 2. Severe cognitive decline or confusion. Cognitive decline is a common aspect of aging, but if the changes in memory, awareness, and thinking abilities are severe and rapid, it could be an indicator that a senior is nearing the end of their life. This cognitive decline might include confusion, memory loss, difficulty recognizing familiar faces, or noticeable change in personality. What to look for. Increased confusion. An elderly person who is usually mentally sharp may begin to show signs of confusion. They might struggle to recognize family members, forget where they are, or even lose track of time. Memory loss. While some forgetfulness is normal with aging, extreme memory loss, where the person forgets events or struggles with basic tasks, can be a sign of a serious decline. Inability to communicate. In more severe cases, seniors may lose their ability to communicate clearly, speaking in disjointed sentences or repeating themselves often. This can be a clear sign that the end is near. Why it happens? Cognitive decline often occurs when the body's systems are no longer functioning optimally. Brain function may be impaired due to decreased oxygen flow or neurological conditions like Alzheimer's disease or other forms of dementia. How to respond. Provide familiar routines. For seniors struggling with cognitive decline, maintaining familiar routines and surroundings can help reduce confusion. A calm and consistent environment can help them feel safe and more at ease. Keep communication simple. Use clear and simple language when speaking with them. Avoid overwhelming them with too much information or complicated sentences. Ensure they understand that they are loved and supported. Sign 3. Difficulty breathing or shortness of breath. As the body's organs begin to fail, one of the most distressing symptoms is difficulty breathing. Shortness of breath can happen even during rest and may get progressively worse, especially in seniors who have underlying health conditions like lung disease, heart disease, or kidney problems. What to look for? Shortness of breath at rest. When an elderly person begins experiencing shortness of breath, even when they're not doing anything physically strenuous, this is a warning sign. Irregular breathing patterns. You may notice shallow, labored, or irregular breathing, especially while they are lying down. Frequent coughing or wheezing. If they are coughing excessively, especially with mucus production, or wheezing, it could indicate that their lungs are having trouble working properly. Why it happens? As the body nears the end of life, respiratory and circulatory systems may begin to fail. The heart struggles to pump blood efficiently, and the lungs cannot supply oxygen to the body at the rate it needs. How to respond? Use oxygen therapy. If prescribed by a doctor, oxygen therapy can help manage shortness of breath. A healthcare professional can guide you on how to set this up and use it correctly. Positioning for comfort. Sometimes elevating the head and torso can help ease the breathing process. Try helping your loved one sit upright or prop them up with pillows to make them more comfortable. Sign 4. Extreme fatigue or lack of energy. It's normal for older adults to feel tired occasionally, but if there's a sudden and profound lack of energy that doesn't go away with rest, it could indicate that the body is beginning to shut down. This fatigue is different from normal tiredness. It can be extreme and persistent. What to look for? Inability to get out of bed. An elderly person may suddenly be unable to get out of bed or even sit up without assistance. Constant need to sleep. They may sleep for most of the day, appearing exhausted even after waking up. Their energy levels may be low no matter how much rest they get. Loss of interest in activities. A senior who once enjoyed activities like reading, watching TV, or even interacting with others may suddenly show a lack of interest or desire to engage. Why it happens? Fatigue is common as the body slows down, especially when there is progressive failure of organs or an advanced disease like cancer, heart failure, or kidney disease. How to respond? Prioritize comfort. Ensure that your loved one is comfortable, resting in a position that supports their comfort and is receiving proper care. Monitor for changes. Keep a close eye on any new developments, especially if the fatigue becomes severe. It might be helpful to track their daily habits to notice patterns that can help a healthcare provider make a diagnosis. Sign 5. Incontinence or loss of control over bodily functions. The loss of control over bodily functions, particularly incontinence, is common among the elderly, but if it becomes more frequent or severe, it can signal a significant decline in health. This may occur alongside other physical changes, or as a result of advanced illness. What to look for? Frequent accidents. If your loved one begins experiencing frequent accidents or is unable to hold urine, it could be a sign that their body is weakening. Loss of bowel control. In addition to urinary incontinence, they may lose control over bowel movements, leading to increased discomfort and embarrassment. Why it happens? Aging or the breakdown of bodily systems, such as the urinary or digestive systems, can result in incontinence. Neurological decline and weakened muscles may also contribute to this issue. How to respond? Provide supportive care. Ensure they have access to adult diapers or incontinence products that can help manage the issue with dignity. Consult a doctor. Incontinence can often be managed with medications or physical therapy, so it's important to consult with a healthcare provider for a treatment plan. Conclusion of Part 1. Understanding the warning signs. Recognizing these warning signs early is crucial in providing the best care possible for your elderly loved one. Whether it's managing physical decline, cognitive changes, or other issues, being proactive and prepared can make all the difference. In the next part of the video, we'll explore how to support your loved one through these stages, with practical advice on care and coping strategies. Part 2. Coping strategies, practical advice, and final stages of care. Managing the challenges and preparing for the final year. In Part 1, we explored the 5 early warning signs an elderly person may be nearing the end of their life, such as physical decline, cognitive changes, and severe fatigue. As we continue, we'll explore the final 2 signs that can indicate an elderly person may be in their final year, along with essential tips on how to manage these stages effectively. Caring for an elderly loved one can be emotionally and physically exhausting, but it's also an incredibly rewarding journey. By understanding these signs and preparing yourself, you can offer them the best possible care during this time. In this section, we'll look at the remaining signs and provide practical steps you can take to ensure your loved one's dignity and comfort during their final year. Sign 6. Significant changes in behavior or personality. As individuals approach the end of their life, it's not uncommon for their behavior and personality to change. These changes can be subtle or dramatic and may leave family members and caregivers feeling uncertain or confused. It's important to understand that these behavioral shifts often indicate that the body and mind are nearing the end stages. What to look for? Withdrawal or detachment. A person who was once social and active may suddenly withdraw from others, not engaging in conversations or activities they previously enjoyed. They may appear disoriented, confused, or even disinterested in family gatherings or visits from close friends. Increased irritability or anger. Some elderly people become more irritable or combative as they approach the end of life. This can be due to discomfort, confusion, or the emotional toll of their declining health. It's essential to recognize that these changes are not personal, but are instead related to the physical and psychological struggles they may be facing. Unusual emotional responses, emotional swings, such as crying more easily or sudden outbursts, can occur. This can be distressing, but it is often a natural part of the process as they confront the reality of their health decline. Why it happens. Cognitive and neurological changes, like dementia or delirium, often contribute to these behavioral shifts. Additionally, a decrease in physical strength and fear of the unknown can lead to increased anxiety and emotional stress. How to respond. Patience and understanding. Behavioral changes can be challenging for caregivers, but it's important to remain patient and compassionate. Try to create a calm, soothing environment that will help your loved one feel secure. Professional help. If the changes become severe or cause distress, it's wise to consult a doctor or mental health professional. They can assess whether the changes are due to medical conditions like dementia, or if they are related to emotional or psychological factors that can be addressed through medication or therapy. Sign 7. The body's decreased ability to heal and fight infections. One of the most significant warning signs that an elderly person may be in their final year is the increased inability to heal and fight infections. When the body starts to fail, its natural defense mechanisms, such as the immune system, become much weaker, and it may no longer respond to infections as effectively as before. What to look for. Frequent infections. If your loved one is frequently getting sick, whether it's a cold, respiratory infection, or even urinary tract infections, UTIs, it could be a sign that their body's immune system is becoming less efficient. Slower healing. Cuts, bruises, and other minor injuries that would have healed relatively quickly in the past may now take much longer to heal. This is often due to the body's reduced ability to repair itself as it ages. Fever or chills. A persistent fever or chills, especially when combined with weakness, lethargy, or pain, could indicate an infection that the body is struggling to fight off. Why it happens. As we age, The immune system becomes less responsive, and organs start to lose their ability to function at their peak capacity. The body's ability to fight off infections or recover from illnesses is compromised, making infections and wounds harder to manage. How to respond. Monitor for signs of infection. Keep a close eye on any changes in your loved one's health. If you notice symptoms of infection, it's important to seek medical attention immediately. Infections can quickly become life-threatening in elderly individuals. Focus on comfort. As healing becomes slower, providing comfort and pain management should be a priority. Work with healthcare providers to ensure that your loved one is as comfortable as possible during this time. How to support your elderly loved one through these stages. While recognizing these warning signs is important, understanding how to support your loved one during their final year is just as essential. As they face these challenges, it's crucial to offer both physical care and emotional support. Here are some strategies to ensure that you provide the best care during this time. 1. Communication. Keep talking to them. Even if your loved one is withdrawing or no longer able to engage in lengthy conversations, it's still important to talk to them. Communication provides comfort and ensures they feel connected and supported. Talk to them about their favorite memories, share updates from the family, or simply express your love and care. Tips for communicating. Simple and clear language. Use clear and simple language when communicating with your loved one. If they seem confused or disoriented, avoid overwhelming them with too many details. Be present. Sometimes just being physically present with your loved one, holding their hand, sitting next to them, can offer emotional comfort. 2. Provide comfort and care. Physical comfort is crucial during this stage. While you cannot stop the inevitable, you can help ease the process by ensuring your loved one is as comfortable as possible. This includes managing their pain, keeping them in a comfortable position, and ensuring they have everything they need for daily tasks. Comfort measures. Pain management. Consult with healthcare providers about managing any pain. Medications like opioids or nonsteroidal anti-inflammatory drugs, NSAIDs, can help alleviate discomfort. Positioning. Regularly adjust your loved one's position to avoid bed sores and ensure their comfort, especially if they spend a lot of time lying down. Nutrition and hydration. While eating and drinking may become more difficult, try to offer nourishing liquids, soft foods, and comfort items like favorite snacks or drinks. 3. Enlist help and support. Caring for someone nearing the end of their life can be physically and emotionally taxing. It's important not to do everything on your own. Reach out to friends, family, and professionals who can provide support. Ways to get support. Family and friends. Don't be afraid to ask for help. Your friends and family members can assist with household tasks, offer companionship to your loved one, or simply provide a break for you. Home healthcare providers. If necessary, consider hiring professional caregivers who can help with day-to-day care, administer medication, and provide specialized care based on your loved one's needs. 4. Consider hospice care. Hospice care is a compassionate approach to end-of-life care that focuses on providing comfort, pain relief, and emotional support to individuals who are no longer seeking curative treatments. Hospice care teams are composed of doctors, nurses, social workers, chaplain, and volunteers, and they focus on ensuring that the last months or weeks of life are as comfortable and peaceful as possible. Conclusion: navigating the final stages with compassion and care. The final stages of life are never easy, but by recognizing the signs and responding with compassion, you can ensure that your loved one's journey is as comfortable as possible. Whether it's providing physical care, offering emotional support, or seeking professional assistance, your presence and love can make all the difference. Remember, while it's hard to see a loved one go, their dignity and comfort should be the top priority in their final year.